Hey there! In today's video, we're going to talk about the influence of culture on mental health. Our cultural background shapes the way we think, feel, and behave, and it can impact our mental health in both positive and negative ways. Let's dive in and explore this fascinating topic further. Cultural beliefs about mental health. Cultural beliefs about mental health can have a significant impact on how individuals perceive and cope with mental health issues. For example, in some Asian cultures, mental illness is often viewed as a weakness or a personal flaw. This can lead to shame and stigma surrounding mental health issues, and individuals may be hesitant to seek help for fear of being judged or ostracized by their community. In contrast, some indigenous cultures view mental illness as a natural part of life and may use traditional healing practices, such as spiritual ceremonies, to address mental health issues. Cultural stigma and mental health. Cultural stigma around mental health is a significant issue worldwide, and it can vary across cultures. For example, in some cultures, mental illness is heavily stigmatized, and individuals may be hesitant to seek help for fear of being judged or discriminated against. This can lead to delays in treatment and poorer mental health outcomes. In other cultures, mental illness may be accepted but not fully understood, leading to misunderstandings and incorrect beliefs about the causes and treatments of mental illness. Cultural protective factors. On the other hand, culture can also be a protective factor for mental health. Cultural values, practices, and beliefs can provide a sense of belonging, social support, and resilience. For example, many cultures place a strong emphasis on family and community, which can provide a sense of social connectedness and support during times of stress or hardship. Additionally, some cultural practices, such as mindfulness meditation, have been shown to have positive effects on mental health. Cultural interventions. Cultural interventions can be an effective way to address mental health issues in diverse populations. For example, some traditional healing practices, such as acupuncture, have been shown to have positive effects on mental health. Additionally, cultural competency training for mental health professionals can help them better understand and address the cultural factors that may impact their clients' mental health. Conclusion. To sum up, culture plays a significant role in shaping mental health and well-being. Understanding cultural differences in beliefs, values, and practices is essential for providing effective mental health care to diverse populations. By promoting cultural competence and developing culturally sensitive interventions, we can improve mental health outcomes for people from all walks of life. Thanks for watching. This video is brought to you by Psych Station. If you enjoyed this video, please like and subscribe for more content like this. And remember, no matter what your cultural background may be, taking care of your mental health is always important. See you in the next video.